Good afternoon, everyone, and welcome to the For the Record webinar, Navigating Career Growth in Healthcare Informatics, Strategies for HIM Professionals. Today's webinar is sponsored by the University of San Diego. My name is Susan Prentice, Senior Accreditation and Education Manager at Great Valley Publishing, the publisher of For the Record magazine, and I will be your host for today's webinar. Before we start the presentation, I have a few points of housekeeping. First, in order to claim credit, you'll need to remain with us throughout the entire 60-minute presentation. Second, at the end of the session, the speaker will begin taking questions. If you have a question, please use the Q&A feature at the bottom of your Zoom window to submit questions to us. The speaker will address as many questions as time allows. You can use the chat box to communicate with each other and other team members. The faculty and planners for this educational activity do not have any conflicts of interest to disclose. And finally, this program has been approved for one continuing education unit for use in fulfilling the continuing education requirements of the American Health Information Management Association. Granting of approved CEUs from AHIMA does not constitute endorsement of the program content or its program provider. And now I'm happy to introduce today's presenter, Dorothy O'Hagan. Associate Professor Dorothy O'Hagan serves as the Program Director for the Master of Science in Healthcare Informatics and Nursing Informatics programs at USD. Professor O'Hagan previously served as the Senior Director of Clinical Health Information Systems at Rady Children's Hospital, San Diego, RCHSD, and has more than 30 years of experience leading and managing successful healthcare projects and teams. In her years at RCHSD, Professor O'Hagan served in many roles, including coding manager, cancer registrar, hospital billing and collections manager, EMR systems analysis, Director of Health Information and Interoperability and Documentation Excellence. Professor O'Hagan served as an elected member of EPIC's Electronic Medical Record International Care Information Everywhere Governance Council from 2013 to 2016, and has been an advocate and champion for patient identity matching to allow for seamless electronic health information exchange. Professor O'Hagan serves as a mentor and teacher to the next generation of health information and informatics professionals through adjunct faculty roles in the San Diego area, including the Master of Science in Health Information Care Informatics program at USD's Hahn School of Nursing and Health Science. Professor O'Hagan's graduate coursework in nonprofit leadership and management from USD complements her background in healthcare by giving her experience in board leadership and governance. Through her graduate coursework, Professor O'Hagan has also provided consulting services for organizations such as the United Way of San Diego. And now I'm pleased to welcome Dorothy O'Hagan.
Well, thank you, Susan. Wow, that was too much. I feel like that was a summary of my life in a couple minutes, but welcome everyone. I saw coming through the chat, someone's here from Hawaii. And so like me, I'm on the West Coast. So good morning to those of you who are on the West Coast like me, and then good afternoon to those of you who are on the East Coast and further. What a pleasure to spend this time with you all to talk about how health information management has changed and what we can do to keep up with those changes. So as you can see the slide in front of you, we have some objectives here. We want to discuss some of the different career paths in health informatics and the skills required for those roles, explain the growing demand for healthcare informatics professionals and the key trends driving the need in the healthcare industry, and then assess the benefits of pursuing further education in healthcare informatics and how it might enhance career prospects and professional skills. And as Susan shared, we'll have some time for questions at the end of the presentation. So as I say something. If you have a question, feel free to just jot it down, and then we'll take some time to go through discussing those. But here we go. So the evolution of health information management, if we're going to talk about the future, I want to talk about the past, and bear with me as I really go and give an in-depth detail. It's always good when you're thinking about where you are to think about where you come from. So health information management, when did it all begin? Now, some of you may know this, some others may not, but even going back to 1600 BC, there's evidence that medical records were written on papyrus. And I mean, going back, the Egyptians were documenting surgeries they performed and the details surrounding the patient care. So fast forward to the early 1900s, that's when the American Health Information Management Association was established, or AHIMA, as I'll say from now on. They were established in 1928 when the American College of Surgeons established the Association of Record Librarians of North America. And their goal was, and I'm quoting this, to elevate the standards of clinical records in hospitals and other medical institutions. So even then, there was a knowledge that, hey, what we're doing, we need to make sure we're documenting this so that others and even ourselves can go back and identify how can we do things better, but then also for those patients, so that as they traveled around, they had potentially documentation of what had been done to them. Now, back then, our profession of health information management, we were known as medical record librarians. And actually, when I received my first credential back in 1984, it was called an accredited record technician, or an ART. Many of you now that have the similar credential, it would be an RHIT, Registered Health Information Technician, but an ART, that was the early credentials. Well, about that time, maybe a little before then, one of the first changes in health information management that I experienced in my career was on October 1st, 1983. And that's when the DRG system was implemented, or diagnosis related group, as a way to categorize patient visits into a classification system for reimbursement purposes. So DRGs were created actually in the 60s by Yale University. And although the system has been modified as healthcare reimbursement for government, although it's been modified using the medical coding system, or ICD-9-CM back then, now ICD-10-CM, that methodology and those classification systems are not typically used across other countries for reimbursement purposes. That's something we do here solely in the US. Many other countries do not use coding as a method for reimbursement. Rather, it's a classification system used for mortality data. So back then, 1983, fast forward, we're still using DRG's modified versions from what was initially implemented, and it really changed the way healthcare is delivered. Now, when people think of one of the next big changes related to our industry, they often think of privacy and security, or HIPAA, the Health Insurance Portability and Accountability Act. And I like to start out here back in 1986, because HIPAA, so often folks think that the P is for privacy. It's actually not privacy, it's portability. And it was related to standardizing transaction code sets. The year 1996, and that was the same year as HIPAA, there was this book out by John Grisham. And I like to give reference to this because the book, called The Rainmaker, again, it was published in 1996, the same year as HIPAA. It was the story of an individual who had cancer, and the insurance company wouldn't reimburse for his treatment. And it's a long story, but at the end of the day, it was uncovered that the insurance company was doing everything they could do to make the individuals jump through hoops to get paid. Now, that's a fictitious story, but before HIPAA, the administrative burden for health systems to get reimbursed was often difficult. So that standardized transaction code set meant that health systems and payers had to work together, and a payer couldn't say, well, you need to use this classification system when you submit your claim to bill for us. And then the hospital would have to map all of their systems for that insurance company. Then another payer would say, okay, you need to do this. HIPAA prevented that. It meant that there are standards and we have to follow those. And actually those standards are really what led to where we are today with interoperability and information sharing. So again, payers could not create their own coding system. They had to follow the standards. So that is really when HIPAA started and the why behind the what, but then privacy was added to HIPAA in 2003. And another story I like to share related to privacy, again, the why behind the what, I'll say that a lot, but back in the 90s, there was a tennis star named Arthur Ashe, and he was amazing. He was one of the first Black tennis champions in the industry. And he was in the hospital and had a blood transfusion. And at the time, this is when the HIV epidemic was, really in the news. And unfortunately, Mr. Ashe contracted HIV from one of the blood transfusions he received. He hadn't even told all of his family members that he was HIV positive and that he was developing AIDS, and then was contacted by the media and they said, hey, we're releasing the story tomorrow that you have the AIDS virus, and there was nothing he could do. Someone had sold his information, and it was, he had to tell his family, and it changed the landscape for privacy. It came to the forefront. There's a lot of other stories, but as a result, in 2003, privacy was added to HIPAA, and now, fast forward, we talk about information blocking and other things, which we'll get into later. So that's a little bit about, okay, evolution of medical coding, using that for diagnosis related groups and reimbursement, privacy and security, but really going back and talking about interoperability and standards. And then the transition to electronic health records. Now, I remember when this was happening, but I didn't know the details. Well, back in 2004, in his State of the Union address, President George W. Bush said, and I quote, by computerizing health records, we can avoid dangerous medical mistakes, reduce costs, and improve care. That was on January 20th, 2004. Wow, 20 years ago. So he outlined a plan to ensure that most Americans would have electronic health records within the next 10 years. So let's fast forward to 2014. He believed that better health information technology was essential to his vision of healthcare systems, and that put the needs and values of the patient first and gave patients information they need to make clinical and economic decisions in, of course, consultation with their healthcare professionals. So that was in January of 2004. Fast forward about 18 months later, something happened in Louisiana. On August 29th, 2005, Hurricane Katrina hit, and that ignited the flame that carried forth the vision of President Bush and his administration. So much so that September 15th of 2005, President Bush, and this is in the White House archives, he said, this government will learn the lessons of Hurricane Katrina. We are going to review every action and make necessary changes so that we are better prepared for any challenge of nature or active evil men that could threaten our people. And so in that, there was a whole report that detailed all the things we needed to learn from that horrible tragedy. And one of the lessons it says, and this is the response to what they need to do, in coordination with the Department of Homeland Security and other Homeland Security partners, the Department of Health and Human Services should strengthen the federal government's capability to provide public health and medical support during a crisis. This will require the improvement of command and control of public health resources, the development of deliberate plans, an additional investment in deployable operational resources, and an acceleration of the initiative to foster the widespread use of what? Interoperable electronic health record system. Now, I know that's a lot of history, but I do like to go back again and reflect on where we were and where we are today. So I think of this analogy because at the time Katrina happened, I personally was reflecting on my past career. And at one time I was a cancer registrar and an oncology data manager. And it came to life for me because I thought, you know, all of those people that had to leave the state, go to family or friends in other states, or even just anywhere someone would take them. And let's say they're going through cancer treatment. Where were their records? Probably in the basement of the health systems underwater, and no way to know where or how or what type of treatment they were on as they went to another state. So it really came to life, and hence shortly thereafter, widespread implementation of electronic medical records began, hence interoperability. I say that word a lot, but at the end of the day, it's just the ability of machines to be able to communicate back and forth and share that information. And it really does go back to HIPAA in '96, that portability, using standards, everyone using the same standards and classification systems so that we could share information. So here we are, current state of HIM. Many of the roles y'all know: coders, identity management, data managers. Some health information roles are overseeing patient portals, of course, privacy and security, chief privacy officers, release of patient information, which could be electronic, it could be paper, and then documentation excellence, or sometimes called clinical documentation improvement. Those are some of the current roles we have today. And I say some because so many departments in health information management are different. Some of the technologies, well, we've talked a lot about electronic health record systems, but also clinical decision support, natural language processing, and of course, computer assisted coding. So many health systems are leveraging natural language processing and computer assisted coding to help their coding teams get to the greatest level of specificity and accuracy for coding. Then we have regulations for many of those different roles. We've talked about HIPAA. And then out of what happened in 2004 and 5, in 2009, we have the Health Information Technology for Economic and Clinical Health, or the HITECH Act. And then other organizations, you know, I'm sure everyone's familiar with the Joint Commission, and when they come and do a survey, often they bring CMS, or the Centers for Medicare and Medicaid Services. So that's really some of the current things going on in HIM. And I bring those up just as a reminder for us as professionals, no matter what landscape and where we go in our future, staying aware of, you know, knowing what the Joint Commission's doing, looking at their initiatives and thinking about how we as information or informatics professionals can help meet our health system goals. So the role of technology in HIM, again, I've talked about this already. EHRs, benefits, challenges, impacts. Well, I want to say that it was not uncommon, not just for clinicians to retire as EHRs were being implemented, but also sometimes health information management professionals. It was hard for them to make the change from paper to electronic. It really changed the way we delivered care. And, but I have a story that should have wrote a case study about this, but as I shared, EHRs being implemented was not always embraced by clinicians. Well, at the time I was working at RHIA Children's Hospital, and we were taking over an adolescent psychiatry unit that was managed by another health system, but being the pediatric hospital in the city, it seemed like it was a better fit for us to take that patient population over. Well, when we did that, we had to move off of that EMR that those clinicians were using, and we couldn't just flip the switch and move them onto ours. We had to stop, and they had to start writing in paper again. They were furious, the clinicians. They wanted to go back to the EHR, and it was sort of a, I don't want to say funny, but it was interesting that here so many people fought and resisted, but once they had been using the electronic health system, they did not want to go back to paper. So now, fast forward, almost every health system is using electronic health records. Emerging technology like artificial intelligence, machine learning, natural language processing, encoding and record completion, blockchain for data security. Those are all things that are really I'll say in the thick of it from a health information and health IT perspective. I think we all have an idea about AI and machine learning, but what exactly is blockchain? So blockchain is a compound word, and I looked up blockchain for dummies. This is where I like to get some of my information to help it make sense to me and my teams, but it's a compound word, and the blocks are the records of data. The chains are the links that link each record has with each other. So blockchains store data in blocks linked together via cryptography, and different types of information can be stored on a blockchain, but they're most commonly used for transactions, like we'll say a ledger. And although secure, it can be very expensive from an EHR perspective, but it's just, again, something for us to be aware of as health informatics professionals, health information professionals. So when we're talking and we're in audiences, or we're in a team, maybe we're on the privacy and security team in a meeting with the chief information security officer, we know what those terms mean and what they reference. Natural language processing, it actually goes back a while. I want to say back in 2003, I was the coding team leader at RHIA Children's Hospital, and there was a company that was experimenting with natural language processing to read radiology reports. And fast forward, it's all over the place. So, and then interoperability, seamless exchange of patient information. So remember back in the earlier slide, we need to be able to share information. And another way to look at it is, okay, I was in the UK and Europe this past year, and when I needed some cash, I just went to the ATM with my debit card. We need our health information management systems and EHRs to do the same thing. That if I'm overseas somewhere, or even across the country or across the city, that's all I need to do to get access to my patient information. And we're getting closer, much closer, but I wanted to use that analogy just so we can think about it. How often do we just go to any bank and use our debit card to take out some cash? That really is interoperability in the banking industry. So with all the changes, we have an immersion of health informatics. There are so many definitions of health informatics. I chose these two, and then on a side note, there is a reference page near the end of the slide deck that you'll have if you want to look any of these up. But the American Medical Informatics Association, I decided to start with them because it's in their name, informatics, or AMIA. They define it as the science of how to use data, information, and knowledge to improve human health and the delivery of healthcare services. I liked that. And then there was another definition that I found. Health informatics is the interprofessional field that studies and pursues the effective use of biomedical data, information, and knowledge for scientific inquiry, problem solving, decision-making, motivated by efforts to improve human health. In other words, it's the science of information where information is defined as data with meaning. So putting both of those together, I think gives us a really good analogy of what exactly we're talking about when we say informatics. So we had a background of health information management. We've talked about the evolution of the electronic health records, which means we need informaticians to help work on those systems. So now that we have that background, where do you go from here? How do you move into those new roles in health information and health informatics as a health information management professional? Okay, so I have this list that I've been compiling for a while, and oh my goodness, there's just a few career paths on this slide, but I probably have about 40 names, and I'll just say some of them related to career paths for someone who's interested in healthcare informatics. Well, at the top, we have our Chief Information Officer, Chief Information Security Officer. We talked a little bit about that with HIPAA. A clinical application developer, someone who's developing software applications, a clinical coding specialist, clinical documentation improvement specialist. All of these roles have some sort of interplay with informatics. Well, there's a clinical informaticist. Well, there's also a health informaticist. There's also an EMR informaticist. Those names are interchangeable often. So for you to, let's say you're looking for a job as an informatics professional, you need to think and look at the different types of titles those positions could be listed as. You could be a clinical IT analyst, a coding manager, corporate director of hospital coding, a data analyst, a data scientist. Now, data analyst, data scientist, I will say you may see education out there that you're pursuing and they say become a data science. Typically, a data scientist is going to be doctorally trained and have a PhD or something to that effect. So just something for you to be aware, it would be more likely that unless you had that PhD, it would be more of an analyst position. But then digital health, digital transformation consultant, again, as I said, the list goes on from population health to integration engineer. They're the ones managing the system integration back and forth. An informatics outreach architect, project managers, manager of clinical analytics. I'll stop going. There's too many to count, but I wanted to share some of those names with you so you have that idea that that role that you're looking for your future or that you're working on with your education, it might be called something different. So just be aware of some of those titles. So as I shared, there's so many roles and responsibilities. I just picked a few here for clinical informatics. Often they're optimizing the electronic health record, or they're working on clinician support. They could be a trainer, someone who is walking the floors in the health system and helping clinicians, or meeting with them, watching their workflow and seeing how they're doing. Is there a way they can make things better? So that would be a skill, clinical workflow understanding, IT proficiency, data analysis. someone who can use Visio or other types of software applications, not to just point out Microsoft, that can draw workflow diagrams, that can view a workflow and help identify how to make it better, more efficient, more effective. But then there's also certifications. So most of you in the health information management space, you're very well aware of certifications. We've got the RHIA, the RHIT, the CCS, the CDHP. There's a lot. There's also a certification by the American Medical Informatics Association called an AHIC, and that is just one example. So you can go to those different professional sites and look and see what type of certification. Now, does that mean you get the certification, you're going to get the job over someone that doesn't? Not always, but it will give you a leg up. And some of those exams are pretty intensive. So at the same time that you're pursuing it and you're studying, you're learning. And as we grow and advance in our career, I'm sure I'm not saying anything you don't already know. We have to keep learning and growing. Maybe you're looking for something in the IT space. So that's more behind the scenes, less walking around the floors helping the clinicians, but maybe system maintenance, cybersecurity. I mentioned integration engineers before. Some of the skills you'd want to have for that is familiarity with network management, cloud computing, security protocols, and also data structures and terminology. So remember those standards we talked about so that the systems can communicate back and forth, whether it's ICD-10-CM, HL7, LOINC, DICOM, just to name a few things. Having an understanding of how all of that works and integrates back and forth to the health system and potentially another health system. As far as certifications, there's so many. I just pulled out one, HIMSS. If you go to their website, they have a certification that someone can pursue. One of the roles that I don't know that we always think about is project management. And I teach in a health informatics program, and many of my students actually consider this as a path, especially those with a health information management background, because they've been participating in projects for their whole career. But project management is a potential opportunity for someone with informatics experience or health information management experience. Some of the roles and responsibilities would be overseeing IT and organizational projects, but overall managing teams as well as budgets. So managing the project, the cost, and so forth. Skills required would be leading teams, time management, communication, having excellent communication, both verbally and written. Some of the other techniques, agile, lean, I mentioned budgeting, but risk management, knowing how to go through and evaluate a system, knowing how to use project or other project software applications to help you stay organized, to make sure due dates are being met, and know how to follow up on individuals that need that. So really some keen skills in organizational behavior and leading teams. Some of the certifications could be PMP, project management. You can go to the PMP website and find information about that. There's also certified Scrum Master, Six Sigma Green Belt, Six Sigma Black Belt. Those are types of certifications that you could explore, not just for project management, but also if you have a desire to make things run more efficiently and effectively. One of the favorites right now that folks are talking about is data analytics, and similar, the program I teach in, we have two tracks. One is for health informatics and one is for data analytics, and it's probably about 50-50. So maybe back 10 years ago when EHR systems were just being implemented, we didn't have a lot of data. We had data, but now we have big data. Hence, this field is really growing fast and faster. So data mining, statistical analysis, predictive modeling, report writing, visualization, meaning creating dashboards and graphs and whatnot. Some of the skills that you'll see for data analytics is Python, R, structured query language, otherwise known as SQL, even advanced Excel. Now I share these because, again, you might not be pursuing an advanced degree, or maybe you have an advanced degree, but there are boot camps and other types of things that you can take, even YouTube, going online and going through and learning some of these skills on your own. That's going to be something that is going to set apart you from others if you get those certifications that they may offer, or you have the ability to manipulate the data, because at the end of the day, we're gathering that data, compiling it into information, because we want to learn something or create knowledge from that data that's now information. And then the goal would be to improve patient outcomes or reduce the cost of care. So machine learning, also statistical analysis. Now I'm working on my PhD right now, and I'm using a system SPSS for statistical analysis, but there's other things that you can use and skills that you could acquire. Now, AHIMA has a certification, a certified health data specialist. So that's something you could look at as well. More roles, we'll talk about some of the emerging roles: chief data officer, telehealth coordinator, mobile application development, health tech entrepreneur, natural language processing, and AI. I've said multiple times, in interoperability and information sharing. You know, there's a saying, there's the 3 R's: repetition, repetition, repetition. I keep saying some of these things over and over. The more you can read and learn about them, the more equipped and the more you'll have to bring as you explore your career advancement. Okay, so we've talked about the history, we've talked about the skills. What about the demand? How am I gonna get those jobs? So in the market, and it changes constantly, and even COVID changed some things because more health systems are putting some of these jobs more in the remote space. That makes it more competitive, because instead of just recruiting from your city, people can apply for positions from all over the US. So there's definitely job growth in data mining, statistical analysis, and some of the top hiring sectors are hospital, ambulatory health systems, consulting firms, tech companies, pharmaceuticals. I will tell you though, if you go to the Bureau of Labor Statistics site, they do not have something related for health informatics. The information is outdated, and I mentioned the American Medical Informatics Association a few slides back. They're actually working to advocate that informatics roles are added to the Bureau of Labor Statistics. If you went there and you tried to find, okay, is it worth it for me? What's the average pay and whatnot? You won't find it. It'll refer you to health information management, and the positions that it describes are more entry-level type roles. So just be aware of that. It's very outdated and you won't find what you need. So some of the demand driving factors are EHR adoption, meaningful use, which is now called promoting interoperability, data-driven decision-making, so the role of analytics in healthcare outcomes and precision medicine, meaning medical decisions at the bedside when that information is coming together and being analyzed, making those decisions right there at the bedside. That's what we mean when we talk precision medicine. Regulatory compliance, so HIPAA, and the changing and the Cures Act, and then consumers. Now that they have access to their EHR portals, they want more and more. And then also, even with COVID, more remote patient monitoring, telehealth options that may not have existed before because Medicare wouldn't reimburse for telehealth. And then that was relaxed during COVID. Hopefully that's something that will stay so that people that have less access to care can continue leveraging those resources. Okay, as an educator, I can't not talk about advancement doing when it comes to degrees or your education. I always tell my students, once you have that master's degree, no one's going to take it away from you. You're always going to have it. And you never know when you're going to be happy that you have it because you needed it. And you don't necessarily know that I'm going to need this in 10 years. So furthering your education, it doesn't just have to be a degree, but expanding the skill set, which I've talked about a few times. So keep looking out there what interests you, and then it doesn't have to be a formal program. It could be something you find on the web and go through modules, go through an association and just learn more, get up to date, but figure out what it is that you want. Do you want more leadership roles? Well, then maybe it's going to be strategic planning, strategic management, change management, even employee development. So expanding those skills, and not just the technical, but what we used to call the soft skills, the behavioral aspect of leadership, looking into emotional intelligence and all kinds of things. Those are ways you can expand your skill set. Expanding that skill set is going to give you career mobility and flexibility, more remote work options, potentially, maybe even consulting roles, becoming an advisor and moving into that space. Revenue cycle redesign, that's a big thing in health information management, is looking at how we can improve things and make them better. Those are all things that an informatics or informatician would know how to do, to look at things and problem solve and make them better. Now, I pursued my master's degree back in 2008. For some reason, I had a desire. I didn't know why, but I did it. I went for it and I did it. And I graduated in 2011. And within two months before I graduated, I was approached by our Chief Information Officer and asked if I would be the interim Health Information Management Director. Fast forward, I became the Senior Director of Clinical and Health Information Systems. I wouldn't have been able to get those jobs had I not already had the master's degree. So that's just something to think about. Again, I didn't know in 2008, when I started my master's degree, what was going to happen in 2011. I couldn't have even anticipated it. So furthering that education will sometimes lead to those higher roles, increased salary potential, and so on. These are just a few degrees you could pursue. Again, healthcare informatics, master's degrees. It also could be informatics. It doesn't always say healthcare. So just as I shared that the titles of the positions are different, the degree titles may be different also. Okay, I'm going to share a few success stories, and I want to leave some time for questions. I see some coming through the chat, so I want to make sure I give you all time for that. But I'm going to tell you 3 success stories of HIM professionals. I'll go really quick. I just want you to know it's possible and it does happen. So story 1 was a student of mine working on their associate degree and took a job as a temp in a health system, was doing really well, and fast forward, took a test that the organization offered, that showed that she had a proficiency for analytics, and the next open position she was given. So she started out with her RHIT, I'm going to say, and then fast forward, moved into an informatics role where she's supporting computer assisted coding within an IT space for health information management. Story 2 is someone who started out as a coder and then moved into clinical documentation excellence and had great ideas of how to make the system better. Also took a test that showed that they were the right person to be working in analytics and informatics, and moved into a role. And then the last story is someone who, good friend of mine, actually started as a file clerk in college at a hospital, and then moved into a software company that worked with health information management as an administrative associate, took on more responsibility, and then became a health information director of a large ambulatory center, and then moved in when health information or electronic health records were being implemented. She moved into a director of a clinical informatics team. She had project management skills and all of that, and then pursued her master's degree. She didn't have her master's degree at that time. And then now is the Chief Innovation Officer for a federally qualified health system, an FQHC. And so it is possible. I'm just sharing 3 stories. I know y'all want to know, but how? How do you do it? How can I get there? We've talked about a lot of this. Again, the skills, organizational culture, become aware of teams, time management, balancing work, education, certification pursuits. You know, you've got to keep learning and growing, learning and growing. So, networking, joining professional organizations, volunteer, attend conferences, reach out to that organization and say, hey, I'm interested in your organization. I want to volunteer. Being on those committees, attending those conferences, that's a way to market yourself and get the word out. Being committed in some of those little things, I'm going to say, and then having folks in the industry getting to know you that are leaders. And then mentorship, I'm not going to leave off here. Someone once mentioned to me how valuable it is as an individual. I should have someone ahead of me that I'm following, someone beside me that I can share what I'm going through, they can share with me, and then someone behind me that I am mentoring and following. So mentorship, it's not always about us giving, it's also about receiving and that openness to continue change and learning. So how do you choose your path? I would look at my strengths and my interests and what is driving me. There's all kinds of tests you can take. Strength Finders is one of my favorites, but looking at those things, I had a person working for me at one point that really wanted to be an informatics individual, and they took an evaluation that really is wired for someone who has that analytical brain, and they didn't do very well, and they were really discouraged. But we stepped back and looked at their strengths, and very strategic, a lot of other things that an analyst doesn't necessarily have or need. So instead of focusing on what she thought she wanted, it's looking to the strengths and the things that you have, not just the things you have, the things that bring you joy, the work that you want to get up and go to work every day, not just because of the title or even the pay. So in summary and conclusion, lots for you to think about. I'm going to say the resonating theme was I would encourage you to continue to grow and develop, learn more, learn the technical skills, understand what regulatory agencies are looking for, what type of quality initiatives are out there, and become proficient in all of that. Keep learning. And then some of the takeaways. Well, I put the learner objectives here. And the first one, my response would be the sky's the limit. Where do you want to be and what tools do you need to add to your toolkit? Start there. For that second one, my response would be information technology is integrated with almost every aspect of healthcare. We need people to design, build, test, validate, implement, and maintain these systems. And I also forgot train. So training too, that's some individuals in the health information management space go on to become EHR trainers. And then for the last one, we need to keep changing as the technology progresses. Formal education, workshops, advanced degrees, and even considering teaching others. When you're teaching others, you have to stay current, especially in the health IT space, because it changes so rapidly. So we have to change with the change, being a change agent. So with that, I'm going to thank you. And here's some of my contact information. Feel free to email me if you have some questions or would like to set up some time to meet. And it really has been a pleasure spending this time with you. I just really appreciate y'all attending. And with that, I will turn it over to Susan.
Great presentation. Thank you very much, Dorothy. So it looks like we have some questions. We have a little bit of time. We have Mary Worsley. And Mary wants to know, what certification programs do you have at your institution?
Well, thank you for that question, Mary. I work at the University of San Diego, and we don't have any certifications per se. It's a master's degree that I have oversight of. However, some of our students go on to look at HIMSS certification. So if you go to the HIMSS website, you can look and see what they have to offer. So I hope that answers your question. Thank you, Mary.
We also have another one from Mary, and she wants to know, what is your thoughts on courses through Coursera, Simple Learn, Allison, etc.?
Well, thank you for that also, Mary. I say there is so much information available to us on, I hope it's okay to say this, but like LinkedIn, YouTube, going through and learning Python. I'm just thinking that out loud. I'm not saying everyone needs to learn Python, but go to the free resources first. Look in your backyard. Look at continuing ed schools that are discounted or free, and then brush upon those skills, and then look through the different software vendors and see if they offer a certification exam. So it does resonate with me from a student loan perspective, absolutely. So there is information and education out there, and case in point, I mentioned I'm a doctoral student. I'm using SPSS. I had never touched it before my doctoral studies. I'm looking for the answers of my questions online, even using OpenAI resources as well. So I hope that answered your question, Mary. Thank you.
And we have another one from, let me see, Laura Feliciano. And Laura wants to know, how do I acquire the skills for Python?
Okay, thank you, Laura. Just Google it. If it's okay to say Google, just look and find a different course or a class and start looking and researching, go to an OpenAI resource and see if you can find resources that are free. But the networking piece, reach out to maybe someone at a local community college who's teaching the course and set up some time with one of those faculty members. They might be willing to give you some tips and tricks. Definitely a lot of books and resources out there. And then going to someone who is maybe teaching it would be a good opportunity because they could give you some tips on where you might be able to go or organizations you might be able to reach out.
And let me see. Well, we do have Stacy said LinkedIn is amazing network. And
Can I just say something really quick?
yes, go ahead.
So the students that I have for their introductory course, we actually have an assignment that is about your LinkedIn profile. And sometimes people say, what are you doing this for? Because it's one of the easiest ways that you can market yourself for free, I'm going to say, and, start following people that you aspire, or look at one of my faculty, his name, you can look him up, Josh Weimer. He is one of the most connected people that I know. And so reading the articles from some of those thought leaders in the health IT space, sharing their articles that they post on LinkedIn, just really having a presence, updating your profile. So many organizations go through or LinkedIn and organizations like them to find people for their roles. So thank you for the person who mentioned LinkedIn.
That was Stacy, and Stacy agrees. She said you just go ahead and follow the people that you're interested in and what they do, and it leads to finding more people.
And so, in all of you that are here, you have the answers. So again, going like Stacy did, going to colleagues in the industry, reaching out, again, the networking, that's going to help you.
And we have one more. Let me see. What specific skills will be most valuable for HIM professionals transitioning into healthcare informatics? And how can attendees start developing these skills before making the career shift?
Well, thank you for that question. And is there a right answer? I'm going to say be a change agent. That's a skill, but it's also an attitude. Having a willingness to go with change, embrace change, being that change agent that brings others along with you. So that's just something an attitude that you can display, and an openness in your current space if you're in a role. Being the one that is, hey, I'll do that. I'm excited about that. Workflow analysis, learning how to observe, and this is something you could also find a YouTube video on, or take a class or a workshop or a seminar where you learn how to break down a process and put it on a workflow diagram. So maybe look into Lean or Six Sigma, something like that, so that you can break it down and then present it, and then also evaluate where something in that process could be fixed. Workflow analysis and design is something that people rarely like to do because it's so detailed, but it's one of the things that's necessary before we make changes, especially in healthcare. We have to be able to evaluate and mitigate issues. So thank you for that question.
And I'm so sorry, everyone, we're at the top of the hour, and in respect of everybody's time, we are going to have that be our last question. So again, I want to say thank you, Dorothy. There was a lot of excitement and anticipation about today's webinar. And just thank you for sharing your expertise on the forecasted trends and future opportunities in HIM. This was a very enlightening discussion.
My pleasure. I wish all of you the best in your future endeavors.
Perfect. Thank you very much. And before we go, your attendance certificates are now available to download. You can follow the instructions on the screen or refer to the final slide of the presentation handout for information on how to complete the webinar evaluation and access your certificate. You will receive a credit claiming email within the next 24 hours. And the presentation handouts were emailed to you earlier today. If you didn't receive them, links to download the handouts will be included once again in the credit claiming email. Special thanks again to the University of San Diego for sponsoring today's webinar and for their continued support for health information management career and professional development. We hope you have enjoyed today's presentation. Thank you for joining us. Have a great day.